That's one of the things that the industry does with its vast wealth. It buys influence, and it also uses its wealth to co-opt any institution that might be expected to stand in the way of its drive for profits. So it co-opts, first of all, the U.S. Congress. It gives generously to political campaigns. It has the largest lobby in Washington. Nothing goes through Congress that it hasn't approved. So it begins with U.S. Congress, and then through the U.S. Congress and the administration, it controls to a remarkable extent the FDA.
We need the FDA. The basic structure and the idea behind the Food and Drug Administration was in the public's interest, and I think the framework is there. What's missing is that there has been no oversight. And Congress has allowed the industry to become the FDA's partner in the development of new drugs.
Some senators said the FDA shares the blame.
One of my concerns is that the FDA has a relationship with drug companies that is far too cozy.
The incentives that we have in our healthcare system and kind of healthcare as a business and all aspects of it, business, are really kind of perverse in the sense of how we should be thinking about the public's health.
I think the public is becoming very disillusioned. They're no longer believing that this is a miracle industry in the sense that they may once have believed that. So in a sense, I think it's just a matter of the public starting to put this all together and put pressure on Congress.
The influence of the industry on American medicine is far too extensive, and we've been naive about it. And we need to separate them and be clear-eyed about what the motives of industry are and what our goals are as a people for our public health.
The relationship between physicians and the drug industry doesn't begin once you have your MD or you're out in private practice. It begins the day you hit medical school. Many medical students are given, quote, gifts on their very first day. It's interesting that those gifts are never things like a free dinner at a fancy restaurant or free tickets to a basketball game. They're not even pens or prescription pads. What they tend to be is things that look like they're about education. So they're a textbook or an ophthalmoscope that you can look through and say, oh my God, I'm going to be a doctor. And I think what that's about is establishing a relationship, establishing good feelings, and a dependency and a sense of entitlement. I work really, really hard, and nobody else is really nice to me, but these guys are really nice to me. And at the same time, the notion that we're all in this together. We're on the same side, the side fighting against disease.
Unfortunately, the tactics used by the pharmaceutical salespeople rely on an entire system that is designed to manipulate what doctors understand about drugs. And basically, the salesperson is the last step in that. We also have to look at how clinical trials are designed and conducted. Right now, clinical trials are designed by the companies that are seeking to push a particular product in most cases. And unfortunately, they are frequently able to manipulate the design of the study or how the results are presented so that their drug comes out looking more favorable. That obviously is not a good way for us to accurately assess whether a drug is useful and safe.
Before 1980, most clinical research was funded by the National Institutes of Health. Academic researchers, quote, snubbed their noses at doing commercially funded research before 1980. When President Reagan came into office, the economy was slow, the ethos was small government, and the NIH funding of clinical studies went down dramatically. The drug companies were very happy to come in and lend a helping hand. Nothing much changed until 1991 because the studies were still being done in universities. But during the 90s, most of that research got pulled out of universities and was brought to for-profit research organizations. Now, nothing inherently unethical about that. It was more efficient and quicker for the drug companies. The problem is that gave virtual complete control over the research to the drug companies. They could design the studies. They have control of data so that many of the authors of the most important articles published in our best journals aren't even allowed to see their own data. They don't get free access to their own data. And they have control over publication. So the bottom line is that now 90% of clinical studies are funded by the drug companies. The odds are 5 times greater that commercially funded studies will support their products.
Suffice it to say that when drug companies set the research agenda, do the research and design the research, have tremendous influence over the people who get to write it up, and in fact have tremendous influence over the journals that publish it, because they're very, very beholden to drug companies for their own financial well-being, then it's not surprising that so much of what we think we are learning is tremendously distorted.
We have studies that are funded by drug companies, and there have been studies of those studies, and those studies of those studies repeatedly show a tremendous bias. They repeatedly show that they will be far more favorable for a drug if they're funded by drug companies. And we have studies showing that authors who write about these drugs, if they get money from the drug companies, they're going to write far more positive information than doctors, authors in medical journal articles who don't get money from the drug company. They may be right, they may not be right, but I'd rather hear it from somebody who isn't getting money from one side.
And more often than not, you can't get the data. I think it would be a major step forward if the drug companies who sponsor research made their data available to impartial scientists to make sure that the conclusions that have been drawn in the medical journals and that are driving our medical care really are supported by the research data. I mean, right now that data is treated like the recipe for Coke.
The data are so hidden and so complex, whether it's gene therapy or whether it's the number of people who die of heart attacks while taking Vioxx. We have to rely on researchers to provide us with that evidence. And I think the most shocking thing is to find that that evidence is simply not available, or it is distorted. And some of it is hidden as trade secrets. Federal trade secrets laws, commercial interests, allow drug companies to withhold some of this information. And I just recently found out, for example, that the Food and Drug Administration does not report all the deaths it knows about in patients who are on certain drugs, because these are considered federal trade secrets.
One of the problems in the drug industry is that studies are frequently either hard to find or the results are manipulated by drug companies. We've certainly heard a lot about that in terms of Vioxx and the heart attack risk. But in the case of Nexium, those studies were printed and reproduced, the results, right in the package insert that the FDA requires accompany the drug in pharmacies. So these were not secret, but it's really fine print and not something that most consumers can understand, whereas the ubiquitous television ads touting the benefits of the so-called healing purple pill are very hard to miss. So this is a case where, I guess you could say it was hidden in plain sight.
The data that I found on the FDA's website showed for Vioxx that in the company's own study, in Merck's own study called the Vigor study, where Vioxx was compared to naproxen or Aleve sold over the counter, Vioxx is no more effective than Aleve, but the important thing is that the manufacturer's own data shows that Vioxx causes significantly more cardiovascular complications, heart attacks, blood clots, and strokes, more than Aleve. And overall, Vioxx is a more dangerous drug than Aleve. So that if I, as a family doctor, prescribed Vioxx for 100 patients in a row, within the next year there would be 2.5 serious complications because I treated those patients with Vioxx instead of Aleve. The New England Journal of Medicine article that was published in November of 2000 that was supposedly based on reporting that research failed to include those two crucial pieces of information.
We need to look at how clinical trials are designed and administered, but then we also need to look at how medical journals publish the results of clinical trials and other research. Right now, unfortunately, a lot of journal articles are written by physicians who either have a financial interest in the company and the product that they're writing about, or have a consulting arrangement. And frequently journal articles are also written, ghost-written, by companies that basically do this as a business and then sign up a prominent doctor to put his or her name on the article.
There's a lot of evidence now that some of those articles aren't even written by those physicians, but are actually ghost-written by the companies for the signature of the opinion leader in medicine who gets the credit and also sometimes gets paid for an article that somebody else wrote.
And that gives a false credibility to the results and creates a very incorrect impression for the doctors and other medical professionals who might read the article and rely on it.
I saw an article in the New England Journal of Medicine in August of 2000 about